Hi, this is the continuation of a series of videos designed to give individuals information that they can use to prepare for a visit to a physician. The videos are designed to help ensure that the individual can ask appropriate questions of the physician and to increase the likelihood that quality care will be obtained. In the next 3 videos, we will discuss heel pain. Some of the more frequent causes of heel pain are Achilles tendon disorders. These include tendinitis, or inflammation of the tendon; bursitis, inflammation of the bursas surrounding the tendon; and tears of the tendon. Bruising of the heel, and possibility that the heel will develop heel spurs. Tender heel pads, usually due to atrophy. Plantar fasciitis. Calcaneal apophyisitis. Peroneal tendon dislocation. Tarsal tunnel syndrome, and pump bumps. We'll discuss each in the next 3 videos. Achilles tendinitis is a result of inflammation and degeneration of the tendon. It is usually a result of overuse. Achilles bursitis is different. The Achilles tendon has 2 bursas that may become inflamed. These are spongy-like substances that are used to reduce friction as the tendon goes over them. One is between the skin and tendon, another is between the tendon and the calcaneus, or the heel bone. Inflammation of the bursa between the skin and the tendon occurs frequently in women as a result of shoe friction. Tenderness can be elicited by palpation of the bursa. Now, the deeper bursa, when inflamed, can be identified by squeezing in front of the tendon. This may actually produce a visible swelling as a bulge on either side of the tendon. Now, bursitis may be treated with an injection of a steroid into the bursa, the use of nonsteroidal anti-inflammatory drugs such as ibuprofen, the local application of heat, the avoidance of shoe pressure by wearing sandals until relief is obtained, and then using a heel raise inside the shoes. Achilles tendon tears are very serious. The Achilles tendon is the largest tendon in the body. It connects your calf muscles to your heel bone and is used when you walk, run, and jump. Although the Achilles tendon can withstand great stresses from running and jumping, it is vulnerable to injury. A rupture of the tendon is a tearing and separation of the tendon fibers so that the tendon can no longer perform its normal function. A sudden and severe pain may be felt at the back of the ankle or calf. This is often described as being hit by a rock or someone stepping onto the back of an ankle. There may also be the sound of a loud pop or snap. A gap or depression may be felt and seen in the tendon, about 2 inches above the heel bone. Now, the initial swelling and stiffness may be followed by bruising and weakness. The pain may decrease quickly, and smaller tendons may retain the ability to point the toes. But without the Achilles tendon being able to function, this will be very difficult. Standing on tiptoes and pushing off when walking will be almost impossible. A complete tear is more common than a partial tear. Treatment options are surgical or non-surgical. The choice is controversial. Both surgical and non-surgical treatment will require an initial period of about 6 weeks of casting or the use of special braces. The cast may be changed at 2 to 4 week intervals to slowly stretch the tendon back to its normal length. Casting may also be combined with early movement to improve overall strength and flexibility. Now let's discuss plantar fasciitis. Plantar fasciitis is usually found with pain on the bottom of the heel or foot. It is most common on the inner side of the heel, about 2 inches from the back of the heel. but it can also produce pain in a wide area and can radiate throughout the bottom of the foot. The patient will usually report that the pain is under the heel, evident upon stepping out from bed, relieved after walking a while, but increasing as the day progresses. The patient will also report that the pain can become worse when sitting, and that the pain is present in all types of footwear. Treatment may consist of nonsteroidal anti-inflammatory drugs such as ibuprofen, steroid injections, and the use of insoles to cushion the area. The patient will have to rest from running and or doing long walks. A tincture of time is important in recovering from plantar fasciitis. Plantar fasciitis usually resolves or heals over a 12 to 24-month period. Well, I hope this helps. In the next videos, we will continue our discussion of heel pain. Have a good day.